Hi, everyone. We're back today with Doctor's Corner. And today we have on Kristen Miller. She's Tripod's genetic counselor. Hi, Kristen.
Hi.
Thanks for coming on today. I know a lot of patients have questions surrounding genetics as just a topic. So we have Kristen on, and she's going to give a little bit of a bio and answer a few questions.
Hi, everybody. I'm Kristen, and as Melissa had said, I'm the genetic counselor with Tripod Fertility. I graduated with my master's degree in human genetics from Sarah Lawrence College in 2010, and I have been working in Toronto as a clinical genetic counselor since then.
Great. No, we're really happy that you came on board to Tripod. So what is a genetic counselor and what do they do?
So a genetic counselor is a healthcare professional who has a master's degree in human genetics, genetic counseling, or something similar. They typically have specialized training in both genetics and counseling. And genetic counselors can work in a very wide range of specialties, including cancer genetics, prenatal genetics, fertility, pediatrics, and more. Some genetic counselors will specialize in a certain area, whereas others will see patients for a number of different indications. Genetic counselors help families understand complex genetic information and the impact that it might have on their families or on their pregnancies. And they try to ensure that the individual understands the genetic information presented to them and that they have the tools to support and make decisions about their medical care. They typically don't give advice to patients or tell patients what to decide or what to do, but instead they help an individual to understand the complex information, their testing options or their results, and then they help them to make a decision that's best for them.
Perfect. No, that's a great overview.
At Tripod Fertility, the genetic counselor will mainly see patients who are using egg donors or sperm donors for a pregnancy. Health Canada has very specific guidelines that require a couple using a donor to complete a genetic screening questionnaire or expanded carrier testing. And the genetic screening questionnaire is a way to get a better understanding of the intended parent and the donor they're matched with family history. So we ask detailed questions about ethnicity, genetic conditions in the family, other medical concerns that may be in the family. And depending on what comes from the questionnaire, there may be further testing or screening offered, or we might be able to discuss recurrence risks for a future pregnancy or risks to that individual.
Okay, great. So when you speak of expanded carrier screening, can you elaborate a little bit more on that?
Absolutely. Expanded carrier screening is a very comprehensive genetic test. It looks for a wide number of different genes and tries to determine if an individual or couple are at risk of having a child with a specific genetic condition. The number of genes in this test ranges, but one of the bigger panels that we offer to clients looks at over 400 different genes and the genetic conditions associated with them. There's a very high chance that we would find someone to be a carrier of a condition. Just over 2/3 of individuals who do this type of testing will be identified as having a non-working gene that's included in the test, but carriers are typically healthy and don't have any medical problems themselves. The chance that a reproductive couple will be carriers of the same condition and therefore be at risk of having an affected child is only about 2 to 3%. And having this information allows for couples to make more informed reproductive choices, including things like pre-implantation genetic testing, prenatal testing, or potentially testing a baby after birth. For couples that are using an egg or a sperm donor, they may wish to use a different donor as well if they are identified as being a match for a genetic condition.
Great. No, that's really good explanation. Thank you for that. Go ahead.
Oh, sorry.
Go ahead.
I was just going to add that testing can be done at Tripod Fertility, either through a blood test, or we can arrange for a cheek swab or a saliva sample that you can do just from your own home. And it usually takes about 3 to 4 weeks to come back. The genetic counselor, so myself, is usually available to review the results with the individual or the couple once they're ready and make sure that they don't have any remaining questions.
Perfect. No, and if anyone is interested in getting some testing done and screening done, they can just contact info@tripodfertility.com and we can arrange an appointment for them. Thank you so much for coming on, Kristen. I really appreciate it, and we'll talk soon.
Great. Thanks for having me.
No problem. Thank you.